Good morning, Nigeria, and welcome to RadioLink, the Radio Nigeria Audience Participatory Program on the network service of Radio Nigeria. Today, as you must have heard earlier, we're looking at managing COVID-19 and isolation centers in the country. I am Olayemj Daniel, who will be your guide on the program. Now, presently, the entire global community is faced with one of the most devastating pandemics in human history, the outbreak of the coronavirus. Based on records by the World Health Organization WHO, the world has recorded about 3.5 million cases from the COVID-19 virus, with the United States, Italy, France, Spain, and United Kingdom as the worst hit countries. In Africa, records reveal that thousands of cases have been recorded. As we speak, WHO has indicated that Africa has recorded over 55,000, and the number keeps rising on a daily basis. Now, for Nigeria, since the index case was recorded in February, we've had quite a number of cases, which also indicates that we now have over 3,000 cases in the country. So, to tackle the spread, the federal and state governments in the country have been making efforts to ensure that the pandemic does not go out of control, such as the lockdown in some states, ban on interstate travels, compulsory use of face masks, prosecution of lockdown defaulters, including buildings, and set up of isolation centers and testing centers for the detection, treatment, and management of persons with the disease. This is besides the provision of non-pharmaceutical initiatives, that's NPIs, and solutions to tackle the disease. And our guest already joining us via telephone from Lokoja, the Kogi State capital, is the Kogi State Commissioner for Information, Hon Kingsley Fanwo. Good morning, sir.
Good morning.
Okunsa.
Thank you very much. I appreciate it.
It's a pleasure to have you on the program via telephone.
Thank you.
Yes, sir. Once again, good morning, sir.
Good morning.
Yes. Now, Honorable Commissioner, it is obvious that the COVID-19 virus is here with us in Nigeria, and efforts are on to tackle it. What is the present situation as regards this pandemic in Kogi State?
Thank you very much. Immediately, the pandemic came into Nigeria when Nigeria recorded her first index case. Kogi State was one of the very few states that immediately swung into action. We ensure that we put in place government policies and measures that would be able to stop the pandemic from spreading to the state. And some of those measures includes shutting down our schools, our workplaces, and all institutions where people could gather. And we also preached social distancing and took a lot of very proactive measures to ensure the virus does not come into the state. We also have health surveillance officers in all of the 239 wards in the state to ensure that anybody coming from an affected state is immediately assessed to ensure that the virus is not imported into the state. So we have done quite a lot, but despite the fact that we've not recorded any case in the state, we have 3 isolation centers to prepare for any eventuality.
So so far, what is the capacity of these centers? Sorry for interrupting, but what is the capacity of these centers? And can you give us location?
Yeah, they have a combined capacity of about 250.
Okay.
And yes, the locations are in Farek Clinic in Lokoja, then our diagnostic center, which is also located within the premises of the Kogi State Specialist Hospital in Lokoja, and also a clinic at Ampa that was even donated by a foundation to be used as an isolation center. So those isolation centers are ready, are equipped, and ready to handle any eventuality.
Now, Honorable Fanwo, there is an allegation that has been in the social media for some time now, in the last few days. And this allegation is that there are cases in Kogi State that have not been officially recorded. Now, what's your reaction to this? Is that true?
Well, we have been able to follow all the procedures and protocols recommended by the World Health Organization as well as the NCDC to ensure that we follow the criteria they set. Anybody who falls within the criteria that is qualified for testing, we will definitely submit their samples for testing. But we are not having that at the moment in the state, and we are working very hard to ensure we do not even record a single case in the state.
Okay, all right. Honorable Fanwo, let's look at some other issues now. The health sector in Kogi State. Are there areas that the state has now beefed up in other issues? Because besides COVID-19, there were all other diseases that were still major challenges in the country. Malaria, Lassa fever was one of them. What is the situation as regards other aspects as we
I
speak?
think the health sector of the state is one of the best managed in the country today. The immediate past Minister for Health came to Kogi State to commission quite a good number of our projects and programs, and was always telling us that we are ahead of even the Federal Ministry of Health in handling issues of healthcare and wellness in the state. When you look at our success in tackling the issue of Lassa fever in the state, you would agree with us that we have the structure, we have the human resources, and we have put in place a lot of healthcare infrastructure to be able to ensure that our people do not die from other ailments like malaria, Lassa fever, and others like that. So we have a very good and robust healthcare policy and infrastructure in the state to be able to ensure healthcare for our people. And that has always been a part of our argument against the over concentration on COVID-19. COVID-19 is devastating. COVID-19 is novel. COVID-19 is something that is just coming into the country. But at the same time, we need to concentrate on some of the elements that are killing our people even more than COVID-19. And that is exactly where the state is steering to.
All right, thank you. Thank you, Honorable Fan. We'll still come back to some of these issues raised because they are so wide and there are so many issues. But let's go, Commissioner.
Yes, I'm here.
Yes. Now, we Nigerians want to know that there are no cases in Kogi State, which is quite cheering news. We're happy to hear that. But how about the scientific proof that indeed there are no cases? How do you run tests? Are you running tests for those who come to hospitals with symptoms that are similar to that of COVID-19? How do you confirm if there are indeed no cases?
Thank you very much. Thank God we are dealing with science and not fiction. So we deal with scientific proofs. The COVID-19 is a global pandemic, and there are global standards for dealing with it. And we are very grateful to the Federal Ministry of Health, to the NCDC, to the Presidential Task Force for following all these global procedures. There are criteria that have been set for people before they could be qualified for test. So people must fall within those criteria before they could be tested. So we cannot just pick people on the street and start doing random tests. And we are monitoring the situation even in our health institutions. And we have not gotten many of those symptoms. And right now, I think it boards on the fact that NCDC already have all these criteria. We are ready to put our people forward for tests. It's not a big deal. And if we have, we will not want to hide it, because when you hide it, it will spread and it will be very difficult to manage. So we are also on the lookout to ensure that we do not allow a single case to go unnoticed. We're in touch with all our health institutions. We're in touch with our people. We've launched a web link that people could self-access, and we could also monitor. Anyone with high risk, we would immediately trace the person and ensure that we have a personal assessment to ensure that nobody is hiding the virus. So I think it's because of science that we have been able to also prove that there is no case in Kogi State yet. Based, if we are to base it on literature and assessment, people will say, how possible will it be when all your borders are already declaring confirmed cases of the virus? Why is Kogi not affected? But this is science, and it comes with proofs.
Okay. Let's quickly talk about the workforce in Kogi State, particularly narrowing down on medical personnel. Uh, it was awash in the media that some medical personnel are threatening that they cannot work further because of lack of incentives and certain equipment, particularly personal protective gear and so on. Uh, how would you react to this allegation or this issue?
Yeah, Kogi is the center of the nation and also the center of attention. So it is expected. Those were mere rumors, and I think even the Nigerian Medical Association came out to deny it, that they were quoted out of context. So we've taken that, and we are moving forward. They've been saying we don't even have PPE, we don't have sample collecting kits and all that. But when the NCDC people came, and we said, okay, in line with your protocol, let's take your samples. They saw that we had PPE. They saw that we have all these testing kits. So we are not responding to those rumors anymore. We are concentrating on how to defend the healthcare and well-being of our people.
Okay. All right. Honorable Fanwo, let's come back to you now. Hello? Honorable
Hello,
Commissioner.
I'm with you.
Okay.
I'm with you.
Now, we don't, at this point, it's difficult not to ask this question because it's been in the media. There are allegations, media reports of hostility towards a delegation from the National Center for Disease Control, NCDC, by your state, the Kogi State government. How true is this? And if indeed it happened, why? What's the situation? Are they still there? Have they left? Were they kicked out of the state? What happened?
Thank you very much. The team from the Federal Ministry of Health and the National Center for Disease Control came to the state, and members of the team were well received by His Excellency, the Governor of the state, Alhaji Yahaya Bello, and all his cabinet members. He thanked them for coming to strengthen the preparedness of the state against any outbreak of the pandemic in the state. And he also assured them that his administration would cooperate with the ministry and NCDC to help his people. He wants to help his people as much as possible. But at the end of the day, he told them that as a very law-abiding governor, he would want to follow the protocols of the World Health Organization and the NCDC. You will recall that some Chinese experts came to the States to help strengthen our fight against this pandemic. And when they came, they were isolated for 14 days, and their samples were taken and they were tested to be sure that they are not bringing the virus to the country. That's a very good precautionary move, and it shows that the federal government followed the protocol set by the World Health Organization. So the governor said he would be following the same protocol since those people are coming from Abuja. Abuja has been affected by the pandemic, so it's wise that the state insists that they should be quarantined and also their samples taken to be sure that they are not carrying the virus. You would also recall that some of the officials had also tested positive in the past. So that shows that we needed caution at that period. And the governor insisted that we should do that in line with the protocols of the World Health Organization. But to our dismay, the officials of the NCDC insisted they will not submit themselves for tests, that they don't want to be tested. So if NCDC is campaigning that people should get tested and the officials are afraid of subjecting themselves to the test, it's a very big crack on the integrity of the NCDC. And that is why we would want NCDC to come out to explain to Nigerians why their own officials are afraid of tests. They insisted they will be going back to Abuja that night, despite all our play, that we are ready to work with them, but they said they will not wait because they don't want to be tested. So I think they would still have to explain to Nigeria because it made us to suspect that there was a conspiracy somewhere against the state because we have not declared any case, and we have issued statements on that we are cooperating, but we also want them to obey their own rules. So it was not a disagreement between the state government and NCDC or Federal Ministry of Health, but it's a disagreement between NCDC and NCDC because they were in contention with their own rules and protocols.
Okay, right now, as we speak, has the state government or NCDC reacted? Is there any cooperation? Because we know even if there's a situation where there's a disagreement, we sometimes disagree to agree or agree to disagree, as the case may be. So, what's the situation now? Are you trying to reach out to them? Are they trying to reach back to you? Because at the end, what we want is a solution to the challenge on ground. We all have to be safe.
Thank you. As a government, we are prepared to work with any organization that will help us in tackling this pandemic and also in strengthening our healthcare infrastructure. So we are open to any sort of discussions that would not be in contravention to international and global practices. They have not reached us. But we listened to them yesterday during the presidential task force briefing, and they said their mission to Kogi State was aborted. They will re-engage the states. So we are waiting for that re-engagement. But no matter what their re-engagement is going to be, we will cooperate as much as possible. But we will insist on them obeying their own protocols and rules that they set. They set it, except they set it aside. We would continue to insist that they obey their own rules because it is our determination and commitment to ensure that Kogi State is COVID-19 free.
Let's give a general response to this.
Yeah, I can understand the concerns of Nigeria, especially on upgrading the infrastructure, the healthcare infrastructure, to be able to tackle this pandemic. That's very much important. The isolation centers, we have been able, like the isolation centers we have in Kogi State, they are well equipped, and we are ready for any eventuality, like I said. So we want most isolation centers around the country to have all the facilities that we needed to make the patients or those tested positive and isolated to give them the minimal comfort. Then also we need to also look at that protest in Gombe. It is a big dent on all our efforts, all the good efforts that we have been making to combat the spread of this virus. Because those people that were protesting, they looked very healthy and agile. So Nigerians have been asking questions. I'm sure you would have seen a lot of videos online asking questions that are these people struggling to breathe and all that. We have to investigate the issue and also be able to reinstate the confidence of Nigerians in the NCDC and the Federal Ministry of Health. So it is also pertinent to know that in Kogi State, we are not hiding any case. We are prepared to announce it today if anyone tests positive. So it's not even something you could hide because it will affect everybody around, and it could be a very difficult thing to manage. So we would want a situation where we'll be able to up the ante on this fight and be able to restructure and reposition our strategies against the spread of the virus.
Okay. Thank you, Honorable Commissioner. Now, let me just joining us. The program is Radio Link, coming to you live on the network service of Radio Nigeria. And in the first half of the program, we've been talking about managing coronavirus and isolation centers in the country. Our guests have been the Director of Hospital Services of the Federal Ministry of Health, Dr. Adebimpe Adebi, and also who has been speaking us via telephone from Lokoja, the Kogi State capital, has been the Kogi State Commissioner for Information, Honorable Kingsley Fanwo. Now, let's continue from where we stopped, where we're looking at one or two issues concerning checking the spread of COVID-19 and also managing isolation center. Now, let's look at a very important issue in terms of spread. Honorable Kingsley, are you there?
Yes, I'm here.
Okay. Now, Kogi State is the confluence state, houses the confluence of rivers Niger and Benue, also houses like a junction where several travelers pass through at one time or the other. Some of them even stay behind for a while before they carry on. How are you checking or ensuring that somehow this virus doesn't come into the state? Or how have you been able to manage whereby this virus doesn't come into Kogi State?
Thank you very much.
Yes.
Apart from the state quadrant committee against COVID-19, under the leadership of the deputy governor of the state, Chief Edward Onoja, we also have our head surveillance team in all the wards. We are working with local government authorities. We are working with traditional rulers. So policing the virus and policing people coming into the state is something that we have been doing even to the grassroots level. So it is very easy for us to detect if anyone is coming in from any of the affected areas. Immediately we access the person. So that's why the success story today has been magnificent.
Okay. All right, let's come. Another analysis says that the entire thing might peak by September. I believe that was the governor of Lagos State now, Sanwo-Olu, Governor Sanwo-Olu, on that the entire cases might peak at that period. What do you think about those projections? Honorable Fanwo, you had the analysis.
Yes, I'm with you.
Go ahead, please.
Yeah, before I answer the questions, I would want to speak to some of the issues raised by the representative of the Ministry of Health.
Okay. Yes,
there.
Okay.
We talk about stopping dogmatism and ensuring we take the issue of dynamism. Yeah, we are ready to go by the dynamic nature of the pandemic. And it is our hope that NCDC would ensure that free flow of communication. Anytime they are changing their rules, they communicate same to all the stakeholders so that we know what to do. But apart from it being a health protocol, and the protocol approved by both the World Health Organization and the Federal Ministry of Health, as well as NCDC, it is logical and normal that if anyone is coming from the epicenter or areas where the virus has affected, it is normal for such a person to be tested so that we are sure, especially when we've been having a lot of friendly fire between the state government and the NCDC. So I think by submitting themselves to such tests, it will give us that confidence and trust. But they refuse to do that. As to those people understanding their limits and responsibilities, right there in the banquet hall of the state government, some of the team members exchanged handshakes with the Director General Protocol to the governor. So he is on quarantine now for 14 days. So that shows that they are not infallible, and it's not written on their foreheads. They have to be tested for us to know and have confidence. Now, let me go to the question. The question you asked are some of the projections by the World Health Organization and some of the stakeholders fighting this pandemic. I think it is important for us to redraw our strategy. What the governor was saying that day was that we should demarcate COVID-19 and then do away with the mentality that it is going to consume the world. With the kind of publicity we are giving to it, some people are even dying before getting the virus because they are afraid. So our sensitization strategy, our publicity strategy must change. And also, we have to look at what I would call coronomics, which is the economics of COVID-19. We have to look at the welfare of our people. How are they going to survive? We are not a giant productive nation. Now, some people are drivers. Some people drive tricycles. Now, if you lock them down for this long, how do they fend for their families? So we need to redraw the whole strategy around COVID-19 and open up our economy. We are consuming all the rice that we have produced now. When we are through with consumption, then we'll have to resort to importing again when we were already close to full sufficiency. So I think we need to redraw the strategy, and that is the challenge I will give to the Federal Ministry of Health and the Presidential Task Force. The strategy from now must change.
All right. Thank you. I like that coinage, coronomics. Maybe later we'll talk. Let's just quickly hear from you now. Nigerians are worried about the number of motor parks in Kogi State, not just in Lokoja now, the state capital or the confluence city. Motor parks spread across the state. How are you managing the people as they travel, that's travelers through the state? This question is coming back particularly on motor parks. Do you make people wash their hands as they come in, as they go out? Do they check temperatures? Are these motor parks properly managed?
Thank you very much. Before responding to that, let me respond to one of the people who sent messages.
Okay,
to ask about the magic that we are doing to stave the virus of the state. It is likened to a mother who treated her first son of malaria fever. And now the last born is complaining of headache. Headache, when you isolate headache, it is not as critical and as dangerous as malaria fever. So it will be very easy for the woman to deal with that. Now, we've dealt with lesser fever. Lesser fever was more devastating. It killed more Nigerians. And, our experience, our structure, the infrastructure that we use in combating lesser fever is helping us a lot in dealing with the issue at hand. Also, it shouldn't be a thing of worry that a state is not having COVID-19. Even in places where the virus devastated, some places didn't still have cases of COVID-19. So it is not. It shouldn't be a big surprise. I think the state should be commended for doing what we are doing right to ensure the virus is not imported into the state. Talking about the motor parks, initially we even stopped vehicles, especially luxurious buses, from stopping over in Lokoja. If there is any passenger to stop in Lokoja, you have to drop the passenger before you enter the town to our surveillance team to assess such passengers so that he will not just go and mingle with our people. So these were some of the measures we took. And now we have mandated the motor parks to provide all the facilities that will help in combating the virus at their motor parks, such as hand washing facilities and also provision of sanitizers and all that. So that is really helping us a lot.
Okay. All right. Thank you, Honorable Kingsley. We'll still get back to you on other messages as they come, because I believe that so many messages are here that are still asking one or two questions. Welcome back. Now, can you tell us, there have been one or two observations made on the messages we read. I don't know if you listened, but one of them was that we should, Nigeria as a country, get to use the Madagascar solution to the COVID-19 pandemic. What's your reaction to this?
Thank you very much. In as much as I think the Madagascar solution is quite a welcome development, I also know that the healthcare and health management is a very peculiar field. So it requires a lot of authentication, a lot of scientific research, because those drugs will be consumed by human beings. So I think I agree substantially with what the Federal Ministry of Health and the World Health Organization, what they are doing to be very meticulous and be careful in carrying out the research, so that at the end of the day, when those drugs and vaccines come out, they'll be very, very useful to the body. But I want government to support homegrown solutions to this problem, because we have a lot of researchers and scientists that can find solutions to the problem.
Okay. Let's quickly go to Honorable Fanwo now. Honorable Fanwo.
Yes, I'm with you.
Yes, we talked about some of the drugs that that have been mentioned in various parts of the world, like remdesivir and hydroxychloroquine. What do you think about these drugs? Are these isolation centers already equipped in preparation? What's on ground?
Thank you very much. I think one of my biggest take home today is the honest admission by the representative of the Ministry of Health there. There is no specific medical regimen yet for managing COVID-19. That is clear. And she also admitted to the fact that in most cases, the infection usually attack and aggravates what the medical conditions of some of the carriers. And I think that is the biggest threat. Someone having diabetes being infected with COVID-19, it will be a very serious situation. And having said that, I think the drugs we are talking about now, the medical field is highly regulated. And until the Federal Ministry of Health and NAFDAC approves such drugs, it will be very difficult for you to stock the isolation centers with those drugs. That, of course, will be illegal, and we will not want to do anything to contravene the law. So we will be waiting patiently for the direction and leadership of the Ministry of Health and the NCDC and NAFDAC to be able to know what drugs they are using to manage COVID-19. That is very pertinent, and that's why most Nigerians are asking this very pertinent question. They might also consider decentralizing this management as much as possible. I know they are already doing a lot of work with the state ministries of health, and I would want them to step up such a handshake, collaborative efforts, so that at the end of the day, together we'll be able to defeat the virus.
Okay. We want a final message to people of Kogi State and Nigerians, and we know Kogi is a state of roots and herbs. What do you think is a way whereby these things can be harnessed to find a solution? Very quickly, sir. You have 1 minute. Your time starts now.
Thank you very much. To all Nigerians, Kogi State government and the governor are committed to fight COVID-19. We believe it is real, but we also believe it should not be public. It should not be marketed. It should not be what we are going to concentrate too much on marketing. We want it demarketed. We want it repeated so that our national life could continue.
All right.
Also, we want to assure the people of Kogi State that government will remain committed to their healthcare. We shall continue to monitor the situation and ensure that we report as soon as any case is found. We pray no cases found in Kogi State. And also, we will continue to strengthen our collaboration with federal agencies that have genuine intentions towards the state.
Right.
And also, as much as possible,
thank you, Honorable.
We would also want our people to keep safe and not consume things that will endanger their healthcare further.
Thank you very much, Honorable Kingsley Fanwo there. That was the Kogi State Commissioner for Information, Honorable Kingsley Fanwo, speaking on efforts to ensure that we curtail COVID-19 in Nigeria.